All right, I'm Jen Nazarino, Academic Director of the Online MPH program, as well as a faculty member and the Associate Dean for Academic Innovation at the university. I am very honored to introduce Dean Ron Aubert, who I consider a mentor and a colleague and a friend. First and foremost, he is our Associate Dean, Senior Associate Dean of Education at Brown University School of Public Health. He's a visiting professor of practice of health services, policy and practice at the school, and of race and ethnicity at Brown University's Center for the Study of Race and Ethnicity in America. Dean Aubert is an epidemiologist, a dedicated teacher, and accomplished administrator. Brown's Presidential Scholars Program, which he directs, focuses on attracting and mentoring high-performing undergraduate students from historically underrepresented groups interested in STEM, social sciences, and the humanities to provide them the support to realize their full academic potential. In his time as Interim Associate Dean of Diversity and Inclusion at the School of Public Health, Dean Aubert has also focused on increasing the diversity of students enrolled in the master's and doctoral programs and helped to advance several strategic priorities, including the school's partnerships with HBCUs. With experience working in the academy, government sector, and healthcare organizations, Dean Aubert has a deep and unique background in public health. In addition to teaching at Brown, he has had academic appointments at UNC, Rutgers, Emory, and Emory. Early in his career, Dean Aubert worked at the CDC in Atlanta, initially as an epidemic intelligence service officer, and later as the chief of epidemiology in the Division of Diabetes Translation. Also, he's also moved on to a series of leadership roles focused on issues related to financing and delivery at healthcare organizations, including Bayer Healthcare, Medco Health Solutions, Aetna, and Research and Evaluation Analytics. Without further ado, thank you, Ron, for joining us today. I'm going to go ahead and let the other panelists introduce themselves, and then we'll go on to have this great conversation.
Thank you.
Hi, everyone. I'm Nitya Ramesh. I'm a dentist and I'm a program manager for our online Masters in Public Health program. I'm really excited to be here. Ron and I have interacted several times, and Ron is like the students' favorite dean because I've seen how he interacts with students, and every time we have an orientation, like Ron comes on and he's always like, "So where are you from? Tell me a little bit about you." And he really knows how to interact with students and get them to be comfortable, and that's one thing that I really appreciate about Ron. And he's also a great leader and a mentor. So thank you, Ron, for being with us today. I will turn this over to Aaron.
Hi, good afternoon, everybody, or evening. By saying afternoon, I guess you can figure out where I am. So I'm part of the fall of 2023 class. I'm located in a little town called Orinda, California. That's about 20 miles directly east of the city of San Francisco. And professionally, I currently am the Vice President of Corporate Finance at Blue Shield of California. And prior to that, worked in banking and technology and small business. So thank you for having me today.
Karis, would you want to go next?
Sure. Hi, everyone. My name is Karis Miller. I'm located in Baltimore. I'm part of the spring 2023 cohort. And a little bit of my public health passion came from working in nonprofits in Baltimore City. And currently now I do project management for a nonprofit called Federation of American Scientists.
Thanks. And Kwesi?
Hi, everyone. Kwesi Ampama. I'm also from the spring 2023 cohort. I'm calling out of Philadelphia, Pennsylvania today. My professional background, I currently work for a commercial cleaning company. I do project management and sales for them, and I also head up their biohazard, infectious disease, and crime scene cleaning division. So it's going to be really interesting to hear about Dean Aubert's FB background and disease control and things like that. I'm really excited to hear about that.
And Brandon?
Hey everyone, I'm Brandon Heavey. I'm also in Philadelphia, actually. I'm part of the first cohort of online MPH students that was fall of last year. I taught high school for a number of years, and now, other than school, I am still working with a group that serves homeless teens in the Houston area remotely, and I work with the local health department on like public health initiatives. So thanks for having me.
So I wanted to just make sure everyone is aware that this webinar is meant to be a more relaxed setting, definitely conversational. We definitely want to get to know Ron on a more personal level. So I'm going to turn to Brandon to start us off.
All right. So first of all, Dean Aubert, thanks so much for chatting with us today. I wanted to ask you about your own background to start with. Where did you grow up? And did that influence your decision to get into public health?
I grew up in Los Angeles, California, and I'm a first generation college student. My parents are from the South. My mother was a daughter of a sharecropper. My father my father's parents my father's father worked in the oil fields and off of the coast of Louisiana, in Homerly, Louisiana. So again, I grew up in an area that was, plagued by a lot of gang violence growing up. And so for me being here, as President Obama would say, is highly improbable. So that's where I'm from. But when I was thinking about college, I wasn't thinking about, I didn't discover public health until much later. When I was thinking about college, I thought I'd be pre-law. And when I got to college, I had no idea what law school would be like, but I was taking political science classes that were just killing me in terms of keeping me awake. And so I took a biology class, and it was intro to genetics, and had a master teacher. And I got really excited about biology, so I switched to biology. And when I did that, I was still wasn't sure what I was going to do. So all of my colleagues who were biology or chemistry majors were all headed to medical school. That's what everybody does. And so I said, well, maybe I'll go to medical school. But since I started late, I hadn't completed all the requirements. And so physics was the one that I had not had a chance to take while I was in college. So a friend of mine just randomly told me, he just got back from Chapel Hill. He said, man, you should go to the School of Public Health, get an MPH, and you can take physics while you're there, and then go to medical school afterwards. So I said, okay. And then I needed to get down to Chapel Hill to be able to interview and things like that. And I didn't have any money. I came from a family that had no money. Yeah. But I did see that the baseball team was going to make a spring trip to North Carolina. So I joined the baseball team to be able to make that trip. Now, I'm not very good at baseball, but Division III school, small, almost anybody who, if you can throw and wear a hat, then you could probably make the baseball team. So I joined the baseball team, went to South to North Carolina. I was able to make my interview, got really excited about the people I met, the faculty that I had a chance to interact with, and then started taking physics along with my public health classes for my master's degree. But I got really excited about this idea of population health. And so this idea of, instead of having an individual patient that you're concerned about, but thinking about the health of a population, that really excited me. And at that time, so I decided this is really something that's more attractive to me that I really prefer to do. And so that was my first introduction to public health, was the first class that I took in epidemiology. And so, I was late to the game, but it was clearly something that I grew more and more passionate about and got excited about. And then that's where I sort of staked my career.
It seems similar to kind of how I got into public health too. And one of the things that really helped were talking to people that were in it that I didn't maybe realize were in it initially, kind of the same way. I ended up having a friend that worked for the health department. Did you have a mentor in public health that kind of helped you along, or maybe other than your friend that encouraged you to go get your
because at UNC you had to apply to the department.
Okay. So
I was just flipping to the catalog, and epidemiology just sounded interesting, not knowing exactly what it was. And when I asked people about it at my college, nobody really understood exactly what it was. I got all kinds of different definitions, hospital infection, things like that. And so it was sort of just taking a chance on something that sounded interesting, and it just worked out as being something that I got really excited about. So, but once you get into school, then you kind of develop a community of people who thought about these things, and you grow very rapidly outside of the classroom, because now you're having conversations with people about topics and things, and UNC was very international also. So I had colleagues from Brazil, colleagues from various parts of the world, South Africa, Israel, and we, so I got to learn very rapidly and very in a fascinating environment of people who were just had great perspectives and had thought about this a lot more than I had. So I was kind of growing up as I was going along. So it's one of those things where you just kind of you sort of follow what seems interesting, then it says, well, that's fascinating, and then you get more deeply interested, and I decided to complete my master's and stay for the PhD. And then then I did that.
Did you think that you would ever be in academia?
So that's a great question, because while I was as I was progressing through my PhD program, I really didn't like this notion of having to write grants all the time. And so I made a decision very early that I prefer to be, so the thing that kind of helped nail that is I did have a colleague who was several years ahead of me, who he had just finished his PhD, and he had worked for several years. So he was the more senior. I guess you could think of him as a mentor. Mm-hmm. And he went to the CDC, and then I went to the CDC for 3 summers and worked there. And so I knew that I wanted to be on the applied side of things. And so as I was winding down my PhD, I applied for the Epidemic Intelligence Service, and which is it's a fellowship program in applied epidemiology at the CDC. And so I ended up getting into the EIS, and then EIS is really kind of the breeding ground for leadership at the CDC, and probably in federal government relates to healthcare, because some of the other agencies, people leave and take leadership positions as well. So I ended up as an EIS officer, did that for 2 years, and that really kind of helped define the trajectory of my career.
Cool. I think Aaron had a question similar to that too, so I'll go ahead and pass it off to him so I don't take all the time.
Okay.
Yeah, thank you. Dean Aubert, thank you again for being here. So I'm curious, when you became interim dean, how did that happen? What was the process?
So as Brandon sort of brought out, I mean, I was very intentional about not moving into the academy, and so I was at Brown. One of the things I did at Brown in the School of Public Health, I was the associate dean, the interim associate dean for diversity and inclusion, and that was a position I took on because the person who was in it left and decided to move to another university. Ashish had been here for about can't remember exactly when. So it was 20. It had to be 20. This was 2021. So we're just coming out of COVID, and so I took that position, and then sort of redefined what DEI would look like at Brown. Created this office, decided that we needed to staff it, and created 3 positions around that, and then we hired a assistant dean for DEI, and then and that was just being launched, and then in March, sometime late March or late March, announcement was made that got an announcement that's saying Ashish was leaving to go to the White House, and so I was trying to figure out, boy, who are they gonna replace them. So I was running in my mind to the chairs. And so what likely chair would be the interim dean while he was away. And then I get a call from the provost asking me to be the interim dean. Now that was something that I had not expected for a whole range of reasons, because I'm not from the academy in the sense that in the traditional sense. And so, so my first question was, why me? Of course, given that I've never landed a R01 grant or T30 or any of the letters that go along with the whole grantsmanship things. I was curious as to why would you think about me for a position like this, because I wasn't really a true academic in that sense. And so and the response was, I had a great background in terms of leadership roles, both in government and in the private sector. There was a sense that I had good judgment. I tended to get along with people, and that my ego wasn't such that I would try to undo all the things that she's tried to get started. So those were all seemed like a rational reason. So I decided to say yes.
So what was it? Thank you. So what was it like initially? Like what were some of the big ahas of being the head?
Well, so it's a very complicated position. So, and there was so much for me to learn, because I never really understood how the money flows in an academic environment. That's really important. So luckily we have somebody who's like really outstanding in terms of the executive dean, Sarah Walsh. So I didn't really have to understand it too much, because she's really good at what she does. And actually the entire dean's office staff was really outstanding. So they were, really the executive assistant and the chief of staff that I ended up in. Both chief of staffs that I had were tremendously outstanding. That helped in terms of transition into the role. I think the other thing that I had not anticipated was just how much stuff you have to be available for. So meaning that in addition to the day-to-day job of helping run the university, there's also a lot of social stuff, like banquets and community, supporting the local foundations and retirement dinners and new faculty welcoming dinners and receptions, and it's a lot of stuff. And so your days are really, really long, and you don't have really complete control of your calendar. There's a lot of mandatory stuff that you have to be at, and the prep for some of this stuff is sometimes pretty voluminous. So there's a lot of reading that you have to do, at night, or the day before, or a couple of days early, and that sort of thing. So that was kind of an adjustment for me. There's a lot. And then the piece that I never really, I don't think did successfully, partly because of the interim nature, and which was why I think I was good as an interim dean and not the full dean, is that there's a huge fundraising component to being a dean. And so, and Ashish is, he's a great storyteller. He's a tremendous communicator, and that's really important for a fundraising role. And I think as an interim, people are not, they're waiting to see what happens.
Okay. Maybe one last thing on this. So you mentioned that you had a variety of leadership roles. So in looking at your background, you've done government agency, you've done the private sector, you've done academia. I'm kind of curious how that career path became your career path. Was it intentional? Did it just happen?
Yeah, it's a great question. I never had any hierarchical goals when I was working. I really enjoyed the work that I was doing at any particular time when a leadership opportunity presented itself. And so it wasn't that I sought these things, but I think I was prepared for the ones that came along, but it was never. So, for example, when I was at the CDC, the natural progression once you leave EIS is to be in a leadership position. And so I started out with a very small group to develop a breast and cervical cancer registry at the CDC, and I had 3 people that worked for me. I had a physician scientist. He's a family medicine doc with a degree in biostat and a degree in data science. And then I had a degree in database technology or something. And then I had 2 software developers that were on the team. Now, I don't know anything about any of those areas. So I'm in a position of leadership on a team where, everybody on the team is much smarter than I am in terms of the content. So my first challenge was to try to figure out, how can I lead a team like that and really help the team meet its objectives. And so part of that was a great experience for me because, again, it's a very technical team, and I didn't have a particularly deep technical background as it related to. This was really a software development team, but I had good team members, and I carved out from one of my primary objectives is make sure they had everything they needed to be successful in getting this job done. And so I understood enough about the technology to be able to articulate the need. And then whenever a technical discussion was required, and I always deferred to one of the team members to be a part of that discussion, if not lead it. And so that was really important. And then I think then after that, I had a range of opportunities. People asked me to apply for other bigger leadership roles throughout the CDC, and I ended up choosing the head of epidemiology within the Division of Diabetes, and that was a great job. We did really interesting work. I had a project in Egypt that had me traveling back and forth to Egypt quite a bit, and a lot of the work that we did in Egypt helped, along with some other studies that were done in Arizona, helped inform the American Diabetes Association and the World Health Organization to change the definition of diabetes, because so many docs were seeing patients with complications of diabetes that hadn't hit the threshold for a diagnosis. And so there was clearly something that had to be done. So the team that I was working on at that time as head of the epidemiology section, the person I reported to took the lead to help inform the American Diabetes Association, who also worked with WHO. And we did a bunch of analytics, partly from this study that we were doing in Egypt. And that really led to the change of the definition of diabetes. That was very impactful work. And so, and that's sort of, so that, again, that was from leading a team of very diverse scientists too. We had a lot of different people with different backgrounds. And then when I went to the private sector, the whole thing started over again. Started with a small team, then I had a team of almost 40 people, my last role, and very diverse backgrounds, and just being able to communicate in a way that we're all on the same page and how we approach the work was something I had to solve very, very early on. So, but I found a way to do that, and we had probably one of the most productive teams in the industry at that time. So again, none of these did I sort of seek out, but I had a smaller team when I was at Meco Health, and then there was these private companies, probably government too, always reorgs. There's always reorganization, and so we reorged, and I picked up. My team size doubled, and so we went from a team of like 13 to 40. And so that was there's a whole sort of readjustment in terms of leadership and organizing the team in that way too. So it was all, none of this was particularly planned. It was just stepping up when the opportunities presented themselves and figuring out a way to do the best you can.
Okay.
can't remember if did I answer your question?
It did, yeah, yeah. I think that last part is really important, the stepping up when the opportunity presents itself. It sounds like that's what you did here.
Yeah.
So thank you for that those very thoughtful responses. I think I'm turning it over now for some questions that were submitted.
Yeah, we're going to get into some questions from some students, and kind of in the same vein. Students want to know, what kind of characteristics make a great leader?
Yeah. So, I think everybody has a different leadership style. And so I think it's important for you to not try to emulate somebody else, but do what's sort of natural and seems natural for you. And for me, it was always about, there's few things that are always really important to me as a leadership position. One, creating an environment and a culture of respect. And that means respecting people's time as well. So when you're at home, I'm not going to be calling you with requests. I mean, I'm very intentional about not emailing and not texting and not calling people when they're not at work, unless there's something really, really urgent. And so that's a part of how I like to define the kind of environment and culture that I like to create. And then the other part is just being very, very, always acknowledge the people who are doing the work. And people have different views about this. So when I was in one of the corporate environments I was in, I had a peer who never wanted the higher leadership interacting with anybody on her team. She always wanted to be the person who interacted with her supervisor, with the C-level folks. I always wanted people to know who did the work. So I always included the people who are actually getting the work done in the conversations, in the meetings, in the briefings. Because if a question comes up, I don't want to say I can get back to you. I want to say, I'll point to Mona. I said, Mona, you want to address exactly how we did that? And for me, there's a strategic advantage of doing that. And because, in some of these environments, and I'm sure Aaron is familiar with this, when it comes time to compensation, a lot of people have fixed budgets. You have distributions where, you have to have so many, you can't have more than so many exceeds expectations and then met expectations, and, you try to force people and require improvement. When it came that time for me, if I had people who were visible and I didn't want to I didn't want to accept the forced distribution, I could work with HR and say, well, it was Jennifer that did X, Y, Z that we got all these media impressions about, and was very prolific in terms of being very important for the company. I said, I can't give her a met expectations. I said, so I would say, okay, well, if I give her met expectations, I want to make sure she gets money like she was an exceeds expectation. So I was able to do that sort of thing because people knew who they were, because they were involved in work, they're involved in the conversation with the executives. And so that when those names came up, I could, to my supervisor, he would take the money from someplace else. So that was, so I always thought that was really important. And it helped, first, it made people feel valued, which I think is very important also. I always want to be in a position where anytime I'm in a leadership position, I want people to feel valued. And so, those are some things that I used to always try to do and I want people to feel like I've always had teams where people, I don't know, I had diverse teams and diversity in every aspect of gender, country of origin, race, ethnicity. And even back then, I didn't realize how important this was, but diversity of political spectrum. I had a group of folks that used to go to lunch every day and get in these heated arguments about, political topics. And heated means that they were passionate, but there was a lot of laughter too, because when somebody comes up with a really good response to what they think is a crazy perspective, there was laughter and there was never any animosity around that. It was all very very passionate, but also very respectful. And that's the kind of space that you want to create. That's the kind of spaces that I always wanted to create. And think about diversity in the broadest sense. And that means, you know, personality types. We got some quirky individuals on the team, that's fine. But when something happens to somebody, like somebody goes out ill or somebody's spouse dies, all these things have happened. And the team rallies together to make sure that work is done. And it's just, that's what you want. And so that's always the kind of environment that I wanted to try to build. And I think that's how I approached it. But, you know, other people have different ways of doing things. But those are the things that were important to me, sort of reflected my core values. Mentoring was also a very big part of what I tried to always have happen in the organizations that I was leading. And and putting people in spaces where we're always learning. I wanted us to be learning as a team. And so I always had some sort of professional development activities, because you want people to feel like they're growing. And if you're in a learning environment, sometimes it's more important than money. I mean, I would try to encourage my team members to apply for, I want people to be candid about, you know, and I always, if I see a job that opened, I think to be within the organization, I thought to be a candidate for, I would approach them and say, you might want to take a look at that. And they would. And sometimes they would say, nah, it's not going to be like being here. So even though it's a promotion for them, they wouldn't want to leave. So unless it was like a lot of money, but that never really happened. So, so anyway, that's for me. I mean, I always wanted to make sure people feel valued, respect their time, feel like they belonged in the group, and respected their expertise. And so I never felt like I had to know everything, because I started out in an environment where I knew very little, right? With that technical team. So I never felt like I knew everything, and I always was open to hearing how people thought about it. I want people to feel empowered with you know, the piece of work that they're working on.
Thank you for that. And I think that's a good segue into our next question, because you don't talk only about using your public health skills to navigate your position, but you also talk about using social skills and people skills on how to, you know, create this sort of synergy with everyone. I think a lot of people are interested in that and seeing how things translate, you know, not only from profession to profession, but maybe from education to profession. So based on your professional experiences and work experiences, and not your senior associate dean and academia, how does this space sort of compare to your experiences working at an entity like the CDC or any other healthcare organization that you've been a part of, such as Bayer Healthcare, Medco, Health Solutions, or Aetna?
Yeah, so those are all really different experiences, right? So, and because the environments are so different. I started in the government as EIS, and that operates a little bit differently, because, you know, they respond to all the outbreaks that are happening in the world, so they move a little bit faster than your traditional government. So, you know, we could get a call from some country halfway across the planet and be there within 48 hours to try to help figure out what's going on in some sort of outbreak, whether it's hemorrhagic fever, which later became known as Ebola. That was, you know, those were the kinds of things that we were able to do. And that's EIS sort of used to operate in a pace that was more like the private sector. But once, you know, I'm out of EIS, then there is a bureaucratic piece that you're always sort of fighting against, trying to figure out how to get things done in the most efficient way. And so that was a bit of a challenge, and so there's some frustrations around that. And I think that in the private sector, things move very, very, very quickly. The timelines are tight, the expectations are, and they're unforgiving. You know, here in the academy, the timelines are always, most of the time, pretty forgiving with some exceptions. But in industry, the timelines are tight and they're unforgiving. So you got to figure out a way to meet them. And so that's where you have to have get that high performing team. People have to work together, and things have to go at a pretty torrid pace many times. I think in the academy, it's kind of a mix. There are a lot of things that operate more like government than it does industry. And so there's a bit of a mix, but there's still kind of a need to try to have good relationships with people in this position. Make sure you have good relationships with the chairs, with the program directors, and because that's all really part of helping the university meet its educational mission. And so that's more like so that's really important to try to make sure you have those kind of relationships. So I think the academy is a little more of a mix between industry and government, probably a little bit more like government, because the academy does have a lot of process, a lot of sense of having a lot of consensus building and that sort of thing, where industry moves really, really rapidly.
I appreciate it.
Kind of going off of that question, another question is, what advice do you have for someone who's getting their MPH? How does one choose the public health area specialization, so government versus academia versus for-profit?
Yeah, so first of all, I think you can do good work in any of those environments. And I think we did really impactful, really interesting work in all of them. And I enjoyed all the places that I worked. I mean, I've only had 3 or 4 employers, but I've had multiple jobs within each of those areas. And I think, so I think of public health as any environment where you're responsible for the health of populations, whether that's that could be on a micro level, it could be for members of a health plan, as it was in one of my earlier jobs. And we did exciting, really interesting work in those environments. We did work we answered questions of public health questions for members enrolled in a health plan. How do we sort of change the benefit design and work with various providers to reduce poor infant outcomes for mothers who are on Medicaid? And that's a public health question, but the focus is really for the members enrolled in that plan, and that's your population of interest. But it's the same kind of public health question. All the methods, all the things that you learn as a public health student, they all come to play. And so those are and then in another environment, when I was at the pharmacy benefit manager, we did fascinating work there as well. What happens if we could describe what happens if people start a medication for diabetes and they're consistently compliant over the next year and a half, compared to somebody who's marginally compliant versus people who are non-compliant. What happens in terms of hospitalizations, ER visits, overall costs, 2 years later? And then you can sort of start thinking about, okay, how do I construct a compliance program to address some of the issues that I'm seeing with this pattern? So again, really good questions. We asked really interesting questions. So first of all, I think you should have a broad view of what public health could be. Anytime you have a chance to impact the lives of a population of people, to me, that's public health, regardless of the environment. And so that's the first thing. And then I think that you should just go where your interests sort of drive you. Now, if you have some ties, then you might make some decisions about compensation. So it just depends on what your interests are and where you think you can have impact. That's sort of how I made the decisions that I made.
Thanks. And with that, I have a follow-up question. Do you, going off of those 3 categories, do you have a recommended pattern? Would you say start in academia first and then go to government? I
would say start with government first.
Okay.
And I would say that because I think, for you to throttle down the pace when you've been moving at a pretty intense pace is in the the industry environment might be frustrating, could be frustrating for you. So that's my that's my opinion. It's not just my opinion.
And I think moving off of that, sort of staying on your interest, I think it's very important that you highlight that public health professionals and people in academia are supposed to prioritize their interests, because that's probably where they'll see the most, benefit and productivity. So kind of highlighting your interest and your position from the outside looking in, what do you think are the most pressing challenges, or on the flip side, the most opportunity that you see that public health students face today or can take advantage of?
Yeah, so that's a great question. I think one of the biggest challenges now is, and there's a number. There's people will tell you about anticipating being able to respond to the next pandemic and that sort of thing. But I think one of the biggest challenges, and one of the ways that we can really improve, is thinking about health communications, how we communicate science, how we communicate health, how we communicate decisions that need to be made. I don't know if people had a chance to participate in the conversation with the dean and the commissioner of health in New York City the other day, and the same theme comes up. And so the work that's being done around health communication, I think, is critical. And I think every public health professional needs to be able to understand how to deal and how to prioritize and how to assess and try to sort out the whole misinformation, disinformation phenomenon, how the platforms work, and having some sort of basic knowledge around that, how to respond to some of that is really, really important, because that really speaks to credibility and trust in the long run. I think that's what we lost a lot of during the pandemic.
And any opportunities that you see that public health students, maybe, more so in academia, what do you think any opportunities that they can focus on?
Yeah, I mean, I think people should, make sure that they're fundamentally sound at every aspect of things that they're working. You don't have to be an expert in everything, but you should be fundamentally sound in understanding data. So your epidemiology classes are really important. Biostat classes are really important, because there's always going to be a part of public health, and making sure you have a fundamental sophistication about data and information, and then the communication piece, I think, is really, really important. I think, and as you look for your public health experience, try to make that relevant, so the things you're going to learn from that, things that you can grow from that experience.
Thank you.
Thinking about how you've built out DEI here, as an advocate for students for historically underrepresented groups interested in STEM through your work with Brown's Presidential Scholarship Program, have you ever faced barriers during your academic and professional journey? And if so, what helped you navigate those challenges?
Yeah, that's a good question also. So I would say that yeah, so you're always going to be challenged. I mean, that's just and that happens in a lot of different ways. And I think having a good support system is really important. Have safe spaces where you can have conversations about things, and people that you trust, because there's a lot of things that happen to you that wouldn't happen to a lot of people, right? As an underrepresented person, regardless of what that means, either gender identity or race and ethnicity or gender. And so I think having a good support system is really critical. And so so that's really been important for me to navigate some of these things, and mentorship is also very, very important. So that's really helps me navigate some of these situations. And so, because there's some things that are just overtly aggressive, And so I don't want to get into the storytelling because you can imagine there's always opportunities to be undermined. And so you have to not you have to kind of navigate that in a way where you don't become the angry hysterical person in reacting to these sort of things, but also have a really good support system. And if you have good supervision, that always helps.
Thank you.
You're welcome.
And then we also want to know what the future looks like for you. Have you
For me?
had any thoughts about that, next steps, or have your interests changed? Have they stayed the same? What are your thoughts on the future?
So the thing for me now in this role that I think about a lot is, one, how do we sort of expand the opportunities and exposures for our students? So, for example, one of the things that we don't do well at Brown is we don't have good interactions or relationships with industry. And I would love for us to have more opportunities for students to get exposed to opportunities in industry, because I think those are spaces that are really in need of great leadership. And so I want to really kind of help facilitate us having those kinds of relationships. The other thing is I'm trying to sort of work with faculty to start thinking about how we reimagine our curriculum in a way that sort of is not training people for today, but also be thinking about what's going to be most important in the future. And so those are the things that and then the other big part of that is, financial aid. And then, I talked to Ashish about this, and he's very passionate about trying to make sure that training in public health is affordable. So those are the things that I think come to the top of my list.
Yeah, and when he talked about the challenges of industry, the challenges of connecting to industry, we do have a Center for Entrepreneurship that I'm a faculty member at part of, and there is healthcare industries that we are very much connected to at Brown. So I'd love to make that connection, Ron, even more stronger between the School of Public Health and the Nelson Center in terms of bringing more industry partners to public health. Yeah,
that's a good place to start. And we started that a little bit. We had a career panel about a month and a half ago that was focused on the pharmaceutical industry. And just from those 5 speakers, we've generated 3 or 4 internship or fellowship opportunities.
Yeah.
So those kind of things are going to be very important for us, I think.
Ron, that was recorded too, right? That webinar was recorded. That was live streamed. So let's make sure to resend that to our students so that they get a taste of some of our current industry partners and what we plan to do in the future. Nithya had there were some students that had some questions. She also had a question for you as well.
Sure.
Ron, my question was, how can students, you were the interim dean and now you're the senior dean. So how do you suggest students can take full advantage of being a master's student at the School of Public Health? What opportunities should they be keeping an eye out for? How do they maximize their time here?
That is a great question. So the challenge with Brown in general, there's just a lot of stuff that's going on. And so I think you have to figure out a way to curate all that to sort out what you can attend and try to do as much of that as possible. The other thing is that I think we talk about this a lot, trying to be more intentional about forums like this. I think it's terrific. I love the fact that you all started this. This is great, and I love the opportunity to interact with students who are part of our online program. But I think take advantage. I mean, all that stuff that's happening. Keep up with it. Check the pulse every week to figure out what's happening, and participate in a lot of very interesting things. I mean, the thing about our dean, he has rock star status, and so he tracks amazing people, and a lot of the faculty that have come in the last 2 years, try to participate in that stuff. The panel on private equity in healthcare, that was another really good one. And so I would say peruse that. You can start discussion groups yourself if you want to talk about certain things. Try to invite either faculty or administrators to participate in some of that stuff. They can find availability. I would. One of the things that I did when I was in graduate school that we did was we always had groups where people got together and either we talked about things or worked together or worked out problem sets together, and do all of that, because you want to try and make sure you make those relationships such that one, you feel supported in a supportive environment where you support each other, and the other, it just expands your network. When I was at Metco, I got laid off. It was part of an acquisition. Smaller company bought us. Smaller competitor bought us, and so they had a group like ours. Ours was the best in the industry. I have no shame in saying that. But since they were the acquirer, our group was the one that got taken out. And so since I was an executive, I had, as part of my severance, I was in this outplacement service, really a swanky outplacement service, where we had these weekly seminars about how to find your next job. And the one thing that I'll never forget is this one statistic where they said that, I think it was 93% of the time people will find their next job through their network or people that they know. And so they spend a lot of time sort of working with us to help cultivate the conversations with our network in a ways that we're not sort of putting pressure on them to give us a job. But a good part of the conversation with your network is not, do you have a job for me? Because people feel bad, they don't want to talk to you because they don't have anything for you. But if you sort of position it as, like to have a conversation, here's some of the things I'm thinking about. They had a whole little template for us to sort of map that out in terms of industries and people that I've talked to so far. These are my goals in terms of the kind of things I'm looking for. Love to have that conversation with you, and for you to review how I'm thinking about it. And if you have people in your network that you would recommend speak to who may have an opportunity, that sort of conversation. And those are the kinds of things that have been really helpful in terms of finding the next job. So a big part of being, get to know your cohort, get to know the cohorts that sandwich you, and find ways to become social online. We used to do, when we were in the pandemic, as part of the Presidential Scholars, we would bring them together and do some fun stuff, but also just some opportunities to just talk about a topic, talk about, what's going on or whatever. And so create those opportunities to get to know each other, because that could be very, very important for you.
Thanks, Ron. So can I ask you, so when you transitioned to Brown, how did someone tap you on the shoulder? Did someone in your network say, because what I've learned, just now having been at Brown for a while, you're so right about networks, but I would talk to other colleagues and they've said, I've never applied for a job. My network has opened doors for me, which is, to be quite honest, as a first gen, I just thought you always had to apply. Me too. Right. And realizing, oh no.
So I was consulting. So one of the things I did once I got laid off from Metco, I started my own consulting group and did that for about five years. And I was at a point where I was in between clients, and I got a call from friends of mine that I knew it was somebody who I knew in the community when I was at Oberlin, one of the kids in town. but I was like his mentor, and I stayed with him. You know, he's like a brother to me. I've known him for like 40 years. And so he was a junior high school kid, and I got to know his parents, and because I stayed in the town for 3 summers, and his wife and his brother. His wife was Trisha Rose, who's head of CSREA, and his brother-in-law, Trisha Rose's brother, Chris Rose, who was associate provost for STEM faculty development. And so they called me out of the blue, and they told me about this presidential visiting professorship that was being started at the provost office, where they were identifying faculty, prospective faculty, diverse faculty, to come to Brown for a year. And part of that was try to see if there was a fit and a place for them. And they told me that one of them was Professor Gates, who was a theoretical physicist. People say he might win a Nobel Prize. He's from University of Maryland. And then there was a young, like 37-year-old John Johnson from Harvard, who was an astrophysicist, had named planets and all of this. And so I said, I don't know anybody. I don't know anybody who's sort of functioning like that level. They said, well, no. We're thinking about if you would come. I said, well, I got 2 rocket scientists. How do I fit into that? They said, well, we wanted somebody who had academic training, but actually did applied work. And so I said, okay, well then if that's the criteria, I don't want to be compared to these rocket scientists. So, but that was that's how it happened. That was my first, that's what brought me to Brown. I was here for 1 year, left and went to Bayer. 15 months in, Brown reached out to me. I guess there'd been a lot of student letters that had been written saying how valuable it was and blah, blah. And so Brown reached out to me for a longer term commitment. So I've been here for 4 years since then. But that's exactly how it happened. I mean, I didn't apply for a job, didn't know a job. There was no job available.
But they made one for you.
It was just something that they created, and they were handpicking the people that they were trying to expose their students to and create opportunities for their students. So that's how that happened.
So we are at time, but I just wanted to thank Dean Aubert for being with us tonight. As we've just seen you, Ron, always so humble, because you are so accomplished, but always so humble, so genuine, so thoughtful in your answers and the advice that you've given to us. So I just want to say that we are so lucky to have you at the School of Public Health at Brown University. We're very lucky to have you as one of our senior leaders. Thank you for your time. And hopefully, Ron, is it okay if some of our students, if they're interested, to reach out to you and maybe even get a little bit more information or get to know you a bit more? I hope that's okay.
Yeah. So, and I would recommend that if you do, put in your email like OMPH, just because, I'll try to, and if you don't hear from me within like 48 hours or so, send it again. I mean, people feel like I'm being dismissive, but the challenge is I get a lot of email, and once it gets below the screen, I just forget. And then if I don't know your name, I might remember. If I don't know your name, I can't find you. And so, so I urge my students of my PSP advisees that got used to that, and they'll send the emails, they'll resend the emails, and just to put it back on top of the stack. That's all they say. And I said, oh, I have to deal with that.
Thanks, Ron.
So, yeah, I'm happy to do that.
Thank you. All right, everyone. Thanks for tonight. Thanks for joining us, and we'll see you again soon. Thank you. Take care.